Dr. Neha. We have three more speakers left. I invite Dr. Amit Kumar Taluja to come forward.
Good afternoon, respected chairperson, everyone present here. Today my topic of presentation is a comparison of isobaric, levobuprofen and ropiaken for lower abdomen and lower limb surgeries. Our study was performed at RD Gadi Medical College, Ujjain. As we all know, spinal anesthesia is simple, safe and easy to perform technique of anesthesia. Technique offers rapid onset of analgesia and adequate muscle relaxation to allow surgery on lower abdomen, lower limb and perineum. Baricity of spinal solution influences the conduct and outcome of spinal block. Earlier use of isobaric solution was obtained by dissolving procaine crystal in the CSF. Some about basic physics. Density, it is the weight of 1 ml of solution expressed as gram per ml. Baricity is the ratio of density of local anesthesia solution to the density of CSF. Isobaric solution are the solution having baricity equal to 1. Barker in 1907 studied the spread of local anesthesia solution of differing baricity in subarachnoid space using glass model of spine. In case of isobaric solution, when injected in lateral position, the dye cuts across the region of cauda equina, and when supine position was adopted, the dye makes no attempt to move upwards or downwards and producing a more localized block than hyperbaric solution. Clinically, block with isobaric solution is excellent for operations on lower limb and lower abdomen, but higher spread is unpredictable. Factors like temperature, internal barbotage, coughing and straining affects the conduct of subarachnoid block with isobaric solution. Positioning after drug admission does not affect the spread of isobaric solution. Study drugs levobuprofen and ropiaken are amide local anesthetics and pure S enantiomers of the parent chiral molecules. The pure S enantiomer developed for the purpose of reducing potassium toxicity and improving relative sensory and motor block profiles. Animal studies and studies on human volunteer shown that levobuprofen and ropiaken are less neurotoxic and cardiotoxic than bupivacaine. The aim of our study was to study the characters of block produced by isobaric levobuprofen and ropiaken, to study the associated hemodynamic changes and to study incidences of complications produced by the study drugs. After obtaining the ethical committee approval, 40 patients of ASA 1 and 2 with comparable demographic profile were included in the study. They were randomly assigned into two groups of 20 patients each. In group L, isobaric levobuprofen 0.5% 4 ml was given, and group R, isobaric ropiaken 0.5% 4 ml was given. Exclusion criteria: patients with ASA grade 3-4, patients refusal, coagulopathy, hypersensitivity to local anesthetics, patients with history of spine surgery or spinal abnormalities, patients of comorbid disease contraindicated the spinal block. In the OT, patient was attached multiparameter monitor and pre-block vitals were recorded. Patient with preloaded with 500 ml of RL and pre-medicated with injection midazolam 1 mg and injection ondansetron 4 mg. Then spinal block was performed under all aseptic precaution in a lateral position. Bilateral pinprick method to assess the sensory level and modify Bromage scale to assess the motor block. And Bromage score of 0 means there is no block, 1 means inability to raise extended leg, 2 means inability to flex the knee, 3 means inability to flex ankle and foot. Hemodynamic parameters were recorded and appropriately treated with atropine or ephedrine whenever indicated, that means pulse rate less than 50 and mean arterial pressure less than 60. The following characteristics were observed: highest diameter level of sensory block achieved, time taken to achieve sensory and motor block, quality of motor block, time for complete recovery of sensory and motor block. The vital parameters were also recorded. The incidences of side effects were also recorded. At the end of study, all data was compiled and analyzed using software SPSS version 16. P-value of less than 0.05 was considered significant. The data on onset and offset character and intraoperative hemodynamic parameters were of numerical type and subjected to statistical calculation by mean and standard deviation test, student test to find out statistical significance, and data on incidences of complications were recorded as number of patients exhibiting the complications. This table showing data on demographic profile, and it is observed that in both the groups they are similar and comparable. Spinal block characteristics: there was no statistical significant difference in the onset of sensory block at L1 level and onset of motor block, and p-value was more than 0.05, and onset of sensory block at T10 level was delayed in the ropiaken group, and it was the difference was statistically significant, and it was same is represented by bar diagram in this picture. Then on duration of sensory and motor block was shorter in case of ropiacaine group compared to levobupiacine group, and the difference was statistically significant, and same is represented by bar diagram in this table. Side effects, mainly 4 patients of levobupiacine group and 3 patients for ropiacaine group presented bradycardia which required treatment with atropine 0.6 milligram, and 2 patients from levobupiacine group and 1 patient from ropiacaine group had hypotension which required treatment with ephedrine 6 milligram. Only 1 patient had shivering in levobupiacine group. This is shown by pie diagram for levobupiacine group and for ropiacaine group. Only few reports are available comparing block characteristics of levobupiacine and ropiacaine. Intrathecal admission of either 20 mg of ropiacaine or 20 mg of levobupiacine was well tolerated and provided similar effective anesthesia for lower abdomen and lower limb surgeries. In an equal milligram dose, ropiacaine produced lower onset at T10 level and shorter duration of motor and sensory block than levobupiacine. Shorter duration of sensory and motor block was also observed by in these studies, and our findings are in accordance with these findings. Slower onset of motor block with ropiacaine group than levobupiacine group was observed by these studies, but we observed no significant difference in the onset of motor block between the two groups. Intrathecal ropiacaine may prove useful when surgical anesthesia of similar quality but of shorter duration than levobupiacine is desired. Since isobaric solutions are unaffected by patient position and spread to both sides equal, spinal anesthesia can be induced in most convenient position for the patient and anesthesiologist, and the patient then can be turned to the position dictated by the surgical procedure. This was a pro forma used for conducting the cases. References.
Thank you, Dr. Amit. Again, as I said, in the interest of time, we move on to the next speaker.